Sinjuri, grazzi li qed issegwu il-programm u l-ħadd it-tajjeb. Il-ġimgħa l-oħra għamilt intervista ma' tabib ieħor, tabib li għadu żgħar li milux li beda il-karriera tiegħu fil-mediċina imma issa tiffoka fuq it-teknoloġija u l-mediċina. Sa nitkellmu ma' Dr. Attard u l-intervista qed issir bil-lingwa Ingliża. Thank you very much, Dylan, for coming to speak to us today.
No, thank you. I'm generally looking forward and excited for it.
I love listening about your career. You've had an interesting professional journey. Can you tell us what made you decide to pursue medicine?
So I graduated in 2017. I've always wanted to do something which was quite meaningful. Was never too happy with just adding numbers. I mean, even though I was good at maths and the rest of the physics and anything else. But when it came to medicine, I was quite fascinated by the whole learning of the anatomy, how the body works, and how one is able to understand how our physiology system, anatomical system works. And the fact that I could possibly even not rely on others to either treat myself, any of my family members, and have the power of knowledge. So that's something that has always been very much, I've been very much attracted to. And at the same time, there's always obviously the whole notion of helping others, helping patients. And back then I was even a little bit fascinated more by the fact of that I could even work abroad in different hospitals. And all of these kind of factors helped to get me more attracted to eventually try medical school. 5 years later, I was working in a hospital, and the rest is history.
You mentioned that you were looking at hospitals abroad. Did you actually manage to go and work abroad as a doctor?
We did, as part of our training during medical school. They used to encourage us to go to different hospitals in summer to work in electives, like 1 month, 2 months, sometimes even 3 months in different hospitals. And I've had the opportunity to go very briefly to Slovenia in my 3rd year medical school, and I actually had only lasted like some 3 weeks in because I was getting homesick. So that was one of the first few times I went abroad on my own for work. But the following years I went to Düsseldorf in Germany, and it was very much of a top-notch public as well as private healthcare ecosystem. So it was very much of a good learning experience. And in my final year I went to the UK. I had always been quite fascinated by the whole working in London, traveling, and the whole NHS system, which back then was obviously a bit more better than its current state at the stage. But those were the 3 countries that I've been to, apart from then eventually going on to study in Ireland at the Royal College of Surgeons in Ireland as part of my postgrad training in surgery.
So you actually specialized also?
So in terms of how our medical system and medical school works here, it's very similar to the UK. So we go through 5 years of medical school training, and then you need to work 2 years under guidance in a public healthcare ecosystem to get your warrant to be able to practice medicine. Then from then you have an option to choose different career paths, be it medicine, be it surgery, be it a family physician. I went into surgery. I knew it was kind of the hardest, and I was always a little bit motivated by trying to do the hardest thing that I believed that there was, which was surgery. Even though I was always quite fascinated by psychiatry, especially when it comes to criminal psychiatry, which I've always was quite keen on. But eventually I went into surgery, and I finished the basic core surgical training, which was the first 2 years and a half, which coincided during the pandemic. So I kind of got to even like work and witness the whole pressure of working and the COVID pandemic.
And what made you decide to become a doctor?
I'm a first-generation medical doctor, so I can't really say that I've looked up to my parents or any family members. So for them, I was quite the prime jewel, I would say, because I was into medical school and going to become a medical doctor. When I look back working in different hospitals and different clinics and different specialties, some of the best moments I remember was when you're treating a patient, be it as on a table, being waking up during the night to assist your consultant in theater for some kind of emergency surgery. I mean, that kind of adrenaline rush in which you're there between a patient who's fighting for their life. I mean, that used to kind of fuel me to become an even better surgeon, even better medical doctor, because at the end of the day, when a patient is going to be waking up from surgery, when you're speaking to their relatives and assuring them that everything's going to be fine, there's that kind of satisfaction, which, I mean, I've never found it in anything else, be it in any business wins, in anything else. And that satisfaction, no other career can give it to you, I guess. And I'm lucky enough to have of having experienced it, even though briefly, I guess.
You mentioned the NHS in the UK. What do you think has made the NHS deteriorate?
The current healthcare workforce is facing an increased demand and pressure to deliver, as well as an increase in demand of workload. The more technology there is, the more advancements, the more conditions are being diagnosed way before. So we're resulting with an increased number of patients going to hospitals or needing treatment for one type of cancer, for one type of medical diagnosis or anything. And I think when you combine these factors, it's what's resulting in our healthcare ecosystems being challenged by our populations. And obviously there's another hot topic in terms of the overpopulations of countries, with increase
and the aging population also.
And even aging populations, which there is an increase in aging population, thankfully, because we're able to treat more people and have them live longer, happier, healthier lives, essentially.
Which brings us to the turning point when you started working in medical technology. So when did that turning point happen for you?
I was always a little bit motivated by the whole entrepreneurial feeling, the feeling of being able to do something on a bigger scale, on a global scale, not just purely for any financial gain, but rather to be able to live an entrepreneurial life. And in fact, I mean, right after I graduated medicine, one of the first things I had done was I had enrolled for a master's in knowledge-based entrepreneurship at the same university, which kind of gave me a little bit more insight into what it takes to become an entrepreneur, how to write up your business plan, how to get funding, and how business and the world works outside the hospital. Because up until then, I was very much of a very sheltered kid, from schools to sixth form to university to eventual medical school. And obviously, I always knew that through entrepreneurship, you're able to solve some problems which I, as a very young healthcare practitioner, was facing throughout my daily works. In fact, when I had done the master's in entrepreneurship, I had done actually a thesis, and it was revolving around telemedicine. The need to practice telemedicine remotely, from e-prescriptions to being able to speak to a doctor. Up until 5, 7, 10 years ago, we're just starting to be able to order our food online, order taxis, check your bank account online, things that elder generations weren't accustomed to, but we're obviously getting accustomed to. But then again, when it comes to our healthcare system, everything was done on a paper, no electronic healthcare records, not being able to speak to a doctor or any other type of physician online. And that was what I did my master's on. And from then, eventually, I wanted to try it out. I wanted to try entrepreneurship. I was feeling very restricted working in one hospital, tending to one patient at a time. And I believed that I could be able to do something which essentially is going to impact more patients or more people on a global scale. And I never looked back, even though the grass is like kind of always greener on the other side. Sometimes you get to say, what if I was still practicing surgery? By now, fellow friends and colleagues of mine are finishing their specialty training. They're nearly becoming consultants. So I'm like, it could have been me. I could have been there, much more stable, much more knowing where I'm going to be. But I chose the other path, which is entrepreneurship and trying to do something which eventually I was loving.
Do you have any regrets?
Regrets, I wouldn't say, no. But I do think sometimes, like, as in what it could have been if I haven't done this. Even like on a personal basis, you're trying to build your own business. Some people think I'm working less and I'm enjoying life more because I get to travel a lot for work. But the reality is I'm working much more possibly than I would have worked If I was still training, your emails, your inbox, work never stops. It's not like I'm going out, I'm finishing my shift, I'm going home and everything stops there. There's always a problem I need to solve. I'm waking up to a different challenge. Then you start growing your own team and you start facing the growth, the pain of growth.
Do you think the advancement of medical technology is the answer to the difficulties of delivering traditional medicine?
I think that's something that even when it comes to the pandemic, it showed different governments, different countries, and different healthcare workforce how technology and the advancements in healthcare, be it through digital health, be it through medtech, are needed to be able to equip our healthcare workforce with the best tools that they can, not to take their place, but rather supplement their work. We come across a lot of different articles, thought pieces about how AI is going to replace one specialty or another, but in reality it doesn't need to replace anything, and AI, at least when it comes to most of the practical uses in healthcare, AI isn't there to replace any human touch, any human connections, but it's there to be able to supplement and equip that physician, that healthcare practitioner, to be able to do the same type of job, possibly at a better quality and at a much reduced time, to be able to treat more patients and reach more people.
And what are the most innovative advancements that you're seeing in medical technology today?
5-6 years ago, even more, we're speaking about electronic healthcare records, patients' histories being made available online, connected to different hospitals. We're speaking about eventually AI in radiology, having different programs being able to diagnose X-rays faster, CTs, MRI scans. This was something out of the blue 5 to 10 years ago, and now it's becoming nearly the norm. Things that currently excite me, and especially I'm very much keen to look forward to, especially in the next couple of years, mostly revolve around robotics. There's a lot of different type of robotics applications being used across different hospitals, from robotics in surgery, from robotics to be able to assist nurses and ward personnel during the daily workloads, as well as when it comes to telesurgery. We've been seeing an increased number of surgeries being done by different surgeons across different parts of the world or countries, to be able to, especially through robotics and through a very good internet and teleconnection, being able to use their manual skills to be able to treat patients in different sides of the world, instead of having patients needing to travel to different countries. I think that's quite, especially I'm coming from a surgical background, so I'm obviously quite keen to hopefully being able to witness and possibly even practice that eventually.
But you actually understand what's happening on the technology side.
Exactly, and that's something that even in this entrepreneurial world, in this in my personal day-to-day job, it also gives me an edge on others, because I'm not just speaking about something from an outsider's point of view, but I've experienced it. I've worked as a junior doctor, I've worked across different specialties, from medicine to surgery to psychiatry, so I'm able to relate how different technologies are being applied across different specialties, and to what extent. When it comes to startups, entrepreneurship, everyone tries to come up with their different cool ideas of how to do this better and how to do that better. But essentially, it all revolves around how you're going to help the physician, the medical doctor or healthcare practitioner, and how you're going to help the patient better, and what problem you're going to be solving. It's not about the coolest product, the coolest device, and there's a lot of buzzwords being thrown around, AI this, AI that. But wearing my physician's hat, I'm able to at least get some insight into, all right, if I was a medical doctor at hospital, would I want to use this device, or is it going to be an extra time for me? Is there another device already in place and this is not needed, or is it just going to increase slightly, which is not even worth the effort to be able to learn how to deploy it, or the hospital to be able to invest in it? And that gives me an edge to be able to know where to focus on.
I'm aware that you're traveling all around the world and meeting the top innovators in medical technology. Who has been inspiring for you? People that you've met recently, for example?
Over the past 2 to 3 years, I've been trying to cover different parts of the globe, purely for me to be able to learn how different regions, different continents, from the Middle East to Asia to North America, are investing into healthcare, and how different cultures are being applied into healthcare. One thing that I've learned is that even though there's miles apart, kilometers apart, different governments, different ways of life, different cultures, all healthcare ecosystems are facing more or less the same problems. Even though it's healthcare and it's not like any other industry, instead of trying to see how we're going to combat and solve these challenges together, everyone is trying to do their own thing at a quicker rate, at a faster pace, at a cheaper thing, to be able to kind of prove themselves that they're better than any other part of the world. And that's something that even through MedTech World we're trying to nurture in terms of the collaborative approach between different governments, between different entrepreneurs across different sides of the world, so that if one is trying to solve a problem and they're investing tons of money into R&D, and the same research and development and what all the research that they've done can be applied and joined with another project who are trying to solve the same issue and get to where they want to be faster. At least what I'm trying to do through MedTech World, we're trying to facilitate this collaboration, because essentially, again, healthcare is not like any other industry. We're essentially speaking about our health and that of our patients and nations, and especially throughout history, and especially something that even the pandemic did teach us, that when the healthcare ecosystem crumbles, the rest of the economies, the rest of the countries, and the rest of the people of society crumbles right after, and healthcare is quite an important pillar of that.
And do you find the approach of different countries, different regions, to be more collaborative or competitive?
I mean, especially when it comes to the current geopolitical issue stances, we're facing like different regions, different parts of the world get to collaborate with different instead of maintaining a worldwide approach. Countries and regions are obviously trying to see who they're wanting to partner up with to be able to beat off any other competition, especially when it comes to different pricing. So, for example, something that I've noticed is that when it comes to Asia, they're keen on developing more companies in robotics and trying to beat the prices of the same companies that are doing the same thing, but are based in Europe or North America, purely for them to be able to say that we've reached faster where we want to reach, and we've beaten this country, and we've beaten whoever. And that kind of hurts, again, because it revolves around healthcare, and I don't think this type of competition should exist in healthcare. If countries and the investors in general are more wise in terms of where to spend money on separate challenges, on separate problems, I would think that even like the whole world in general, if we're ever going to face another pandemic very similar to what we faced, we're going to be much more equipped to fight it better than how it did last time around.
Do you see yourself bringing people from the medical world together?
Yep, I mean, that's something that obviously I'm trying to devote myself through MedTech World, in which we're trying to not just purely organize events and conferences worldwide, but rather be able to connect on a one-to-one basis with different key stakeholders across different parts of the world, to be able to invite them to the different roundtables, to different discussions, to facilitate conversations in MedTech and health tech. We've started off from home, from Malta 5 years ago, and since then we've obviously covered the globe quite a bit. Very proud to say that so far we're doing quite well in terms of connecting different countries, different regions, from the Middle East to Asia to North America to Europe, whilst at the same time helping smaller countries, smaller island states like Malta be on the same discussion tables as the bigger ones, to be able to get inspired by them, to be able to collaborate with them, and eventually work together, because obviously bigger countries have much more bigger budgets to spend on research, development, and the health and their healthcare ecosystems in general.
And what about regulation and medical technology? How does that work?
Different regions approach it differently. Europe has its own regulations, Asia has its own regulations, and North America has its own. which sometimes goes on to hurt the startups, the companies who would need to invest different times, different resources to be able to apply for different regulations across different jurisdictions. And these are often even faced with a lot of red flags, bureaucratic procedures, which exhaust a lot of very fresh ideas and exhaust a lot of budgets of these startups, who instead of focusing more on their research, on the development, on growing their product, they need to focus more time, more resources to be able to apply to these different regulations. And I think it's about time that different regions and different territories around the world met to be able to align more the different needs, the different regulations, because essentially we're all speaking about the same things. We want our medical devices, we want our digital health solutions to be able to be safe for everyone across the board. So I can't fathom how a device that has been approved in one part of the world and made safe is being faced by criticism and is being faced by lengthy procedures to be also labeled safe in another part of the world.
Do you see harmonization of regulation realistic eventually?
I would hope so. And I would also hope that different key leaders are willing to do this, and not continue trying to fight it off to prove a point that we're more stringent than others, that our healthcare system is much better than one or another. So I would hope that the more effort different organizations, like what I'm trying to do with bringing different people from different parts of the world discussing together in one room, in one conference, in one event, is going to help facilitate more relationships. Because essentially, as we've been seeing even on a geopolitical issue, on an international scale, everything boils down to the relationships of different key leaders across the board.
I wish you all the very best of luck, Dylan, and thank you very much for coming to speak to us.
Thank you for inviting me. It's been an honor.
Signori, grazzi li segwejtu l-programm illum. Iffukajna fuq il-mediċina nistgħu ngħidu għax l-ewwel tkellimna lil Dr. George Vella, il-President Emeritus, u kellimna dwar il-karriera tiegħu bħala tabib iż-żejtun. U waqt il-parti l-oħra tal-programm tkellimna ma' Dr. Dylan Attard li qed jara il-futur tal-mediċina bit-teknoloġija li għandna illum. Jekk għandkom xi kummenti ibatuhom permezz tal-WhatsApp fuq in-numru li jidher fuq l-iskrin. Jiena Hogg għal Net TV nixtieqilkom il-ħadd it-tajjeb.